the neurological exam. It's an important examination, especially when someone is complaining of pain beyond the gluteal fold. So if a patient's complaining just of back pain, but no pain down, no radicular pain or referred pain down into their leg, you don't necessarily have to do a complete neuroexamination. But if they do pass the gluteal fold, any type of symptom, you should proceed to do a neurological exam. So there are going to be three components that we're going to look at. We're going to look at motor, reflexes, and strength. So to have the so when you're doing all three processes, to have the patient not sit on the plinth, come back up, you want to try to complete the examination. So with standing, once you've gone through your active range, I'm going to test her S1 dermatome while I have her standing right here. Okay, so if I could have you stand on your right leg, and I want you to go up and down 10 times on your toes. So here I'm looking at how well she does it. Is she able to come up? How far? And making sure she goes 10 times. And then same thing on the left leg. And I'm just holding her here for balance so I can really assess her strength. And so that's testing S1. Okay. Let me have you lying on your back. To continue testing the motor part of the exam, I'm going to put her into hip flexion, testing L2. Now I would test the uninvolved side first and then test the involved side. So I want you to hold here and don't let me push you, so resist me here. So hold for a good 3 seconds and then relax. Any problem? Any increase in symptoms? Okay. Testing L3. Here I'm going to stabilize her pelvis. I'm going to bring her knee into a bit of extension and resist me here. Don't let me push your heel towards the table. So hold here, hold, hold, hold. So that's L3. L4 is going to be ankle dorsiflexion. So here I can test both at the same time. I'm going to have her bring her ankles up into dorsiflexion, cross arm, and I'm going to ask her to hold here, and don't let me resist me here. Don't let me push your ankles down. So hold here, and that's ankle dorsiflexion, L4. For L5 myotome, I'm going to have her extend her big toe. And here I'm going to put my index finger on her proximal phalanx and just hold here. Don't let me push, and compare both sides. And so that's primarily testing L5. Then I'm going to have her curl her toes. Testing S2. Don't let me straighten your toes. Hold there. And curl your toes and hold here. Now, I would test her other myotomes to get her in prone, but I'm not going to do that. I'm going to do, since I want to do everything that I want to do in supine, so here I'm going to test her sensation. If a patient doesn't complain of any sensory loss, any numbness, tingling, then you're not required to do the sensory aspect of the examination. But if they do, then you are required to do the sensory part. So you want to make sure that they don't have clothing that's going to interfere with any sensation that they might have. And you want to obviously compare both sides. So you want to use a somewhat sharp object. I'm going to use the end point of this reflex hammer. But sometimes a safety pin or a pinprick will work just as well. And what I'm going to first explain to the patient is you feel that sensation. I'm going to test different parts of your skin, and I want you to let me know if one part feels different than the other. And I'm going to pick certain areas, certain zones that we have a certain reliability that they affect a particular level in the lumbar spine. So tell me, does this feel different than that? So L1, so I'm going to go L2. Feel different than that. Going to go L3. Different than that. going to go L4, different than that. To go big toe L5, different than that. And then I'm going to go lateral to S1, different than that. So that's pretty much the sensory part, and then I could test S2 if she's in prone. While I have her here, I'm going to test her reflexes. So I'm going to primarily look at L3-4 at the patella tendon and L5-S1 at her Achilles reflex. I like this position in testing because here the patient is relaxed. Another way of doing it, you can do it in sitting, but if you have a disc patient who can't really tolerate sitting, this can be a better way of really getting them to relax and getting an effective way of testing their reflex. So with the patella tendon reflex, what we want to do is do 6 times, nice, even distribution. And why we want to do it 6 times is to look if there's any fatigue. Sometimes you may get a good reflex the first time, but if you do it several times, you'll notice that there may be less of a reflex. So that's L3-4, her patella tendon. Then I'm going to do Achilles reflex. So here what you want to do is put a bit of a stretch on the Achilles tendon so that you can get a nice reflex, and you're going to hit 6 times. And you're going to do both sides. Okay, now to finish off her examination, I'm going to have her lie in prone. So again, let me have to do that. So we can test her hamstrings to look at L5-S1. So I can bring her knee into a bit of flexion, stabilize her pelvis, and hold right here. Don't let me push you down, and relax. And then I could look at S2, where I could come more medial into her calf to see if there's any sensory loss here. One thing to consider to determine when somebody comes in is part of their problem, part of their central nervous system. There are 2 tests that we can try to use to determine if they have any hypertonicity. One of them can be the response to their reflexes, where there will be hypertonic, versus if it's more peripheral, it will be hypotonic. But the other 2 tests are going to be the clonus and Babinski. So clonus, I'm going to take the patient into dorsiflexion and do a quick stretch. And with some patients, they may have 1 to 2 beat clonus, but a positive result is going to be significant 6, 8 beat clonus, where they're going to have multiple beats to their clonus. And you're going to compare both sides. With Babinski, you're going to take the edge. You can use the reflex hammer. Going to go to the lateral border of the foot. You're going to come up top and across the foot. And so she has a nice positive response where her toes curled. I mean a negative response where her toes curled. A positive response would be her big toe would fan out and her toes would extend up.